everyone, and thank you so much for joining us for this maiden edition of Educating for Public Health Literacy with Tolu Omadara on Amogate Radio Communications. It's such a joy, such a pleasure, such a delight to have you with us on this edition that promises to be the beginning of it. Let's talk about public health literacy for starters, right? Now, public health literacy is highly connected to public health, and I'll explain what I mean in a moment. Research has consistently found that there's a correlation between the amount of or the degree of health literacy that a people have in a particular community or nation and the extent or level of public health that is found in the same environment. And so, although causation is not necessarily correlation, in other words, we cannot say that it is the direct cause of health, public health, or effective public health. Definitely correlation is significant cause for inquisition, right? So at the very minimum, we want to dig deeper into this issue of public health literacy and see what we can do in different communities and nations to ensure that the amount of literacy in the public about public health continues to be on the increase. Now, I need to say something as we begin this program. Do not assume that this is necessarily tied to either so-called developing countries or developed countries, right? Because the research as recently as the year 2020 has actually indicated that even in so-called developed countries, there is still a need to ensure that the public is health literate. I repeat that. The research has shown, even in a study as recently as the year 2020, that even in so-called developed countries like Canada, like the United States, like Germany, right, the research still indicates that there is a need to up the amount of education that the public actually has about health. So public health literacy is a sine qua non. We can proceed, if I can put it that way, we can say that public health literacy is a sine qua non for effective public health in nations across all jurisdictions. This is Tolu Omadara again on a new program titled Educating for Public Health Literacy. I'm Amogate Radio Communications, and it's a joy to have you with us. We'll be back shortly. So let's continue. Again, let's look at the data. Let's see what the data is indicating thus far. So findings from a comparative European study on health literacy showed that in about 8 countries, almost half of the people who responded to the survey had limited health literacy. I repeat that. In about 8 indicative European countries, in a comparative study conducted, right, the research showed that almost half of the respondents had inadequate, problematic, insufficient health literacy, right? Now, similar results were also shown in earlier studies from the United States and Canada, right? In the survey conducted by the former Canadian Council on Learning, they estimated that about 66% of Canadian adults lacked the capacity to obtain, understand, and act on health information and to make appropriate health decisions on their own. I'm going to go back to that shortly, right? So take note of the percentage. About 66% of Canadian adults, that's 2 out of 3 Canadian adults, and 9 out of 10 Canadian seniors. So about 90% of much older Canadians and 66% of Canadian adults actually lacked the capacity to obtain, understand, and act on health information, right? And subsequently make appropriate health decisions on their own. This is interesting and not in a positive way. I repeat that. It is interesting and not in a positive way. This is the basis for why, as we continue this stretch of programs we've been having on public health, we think it is time for us to begin to look at the issue of public health literacy. Because the more the public is empowered to know about public health, to know about how to obtain health information, process health information, comprehend health information, and subsequently act on health information in order to make the appropriate health decisions on their own, then they higher the likelihood of a much healthier public. So whether we like it or not, if we are truly interested in public health, because the doctor will not be there all the time, the pharmacist will not be there all the time, the specialist will not be there all the time, the nurse will not be there all the time, adults need to be empowered and they need to have the capability to obtain public health information, to process public health information, right, or health information generally, to comprehend health information, to act on the health information they have received, obtained, processed, understood, and then most importantly perhaps make the appropriate health decisions on their own. In the absence of this, we may not be able to attain the public health levels that we need. Health literacy is a critical requirement of effective public health. So this is the reason why we are looking at this topic, educating for public health literacy. Now I need to go to another dimension of this, and that's the word educated. Why exactly are we using the word education? Because again, the research has indicated that there's a strong correlation between education and health literacy. And remember, we are not talking about general literacy now. We're talking about health literacy, the ability to obtain health information, to process health information, to comprehend health information, and to act on health information we have received in order to make appropriate health decisions. This is not the regular literacy. It's not just about the ability to read and write. It's the ability to do all of the understanding and the processing and the acting on the information process with respect to health information. So one of the things that has been discovered is that the education setting is one of the critical settings identified as a common requirement to deal with poor health literacy all around the globe. They've checked this in Asia, they've checked this in Europe, they've checked this in North America, and they've seen that the education setting, because when we talk about policy, these programs that we do, especially the health programs that we do on Amoge Communications, we do them essentially because we believe in the human capital imperative in the task of nations building, plural, nations building. And it is our strong opinion that health is the foundation of that rubric. On top of health will be education. On top of education, we now sort of cement it with effective workforce development and deployment. And at the apex, we now begin to talk about leadership development and pipelining. So at the bottom of that is health. If people are not alive and well, we can talk about educating them. If we don't educate them, we can talk about workforce development and deployment. And if we don't have effective workforce development and deployment, we cannot proceed to leadership development and pipelining. And so we are looking at this foundational building block of health. We've been on this for about a year, since September last year, almost going to a year now. We've been looking at the issue of public health and the exploration of national possibilities. We proceeded to innovative possibilities for public health management. And from all of the analysis, the engagements, the interviews we've been having with experts, we are saying that there is a need to look at the issue of public health literacy. How do we empower and equip the public to be more aware of health issues in order to be able to obtain the health information they need as they needed, to process, to comprehend, and to make effective decisions based on the health information, all on their own before it gets to the level where they are needing medical intervention. This is still Tolu Omodara on Amoge Communications. This is the beginning of a new series called Educating for Public Health Literacy, and today we are laying the foundation. Thank you for being with us, and I'll be back shortly. So, as we're saying, education has found, research has proven that education, right, the education setting, not the public health education, the general education setting is one environment, one channel, one tool, one prism, so to say, through which we can channel health literacy. If you want to empower people, the public, if you want to empower the majority of people to become aware of health information, how to access it, how to process it, and so on and so forth, we can use the education channels. However, I also must say that from the research we have been doing so far, this is easier for the younger generation, right? Fortunately and unfortunately, I'll explain what I mean by both. Now, what I mean by that is that fortunately, we can start anew with those who are just growing. Unfortunately, with those who have already grown, with those who have already passed through some education settings, we have to get a bit more innovative with how we want to in other words, how we want to grow, how we want to enhance, how we want to enrich health literacy among people of a certain generation. But thankfully, for those who are just growing, before they pass through that phase again, and we begin to think of how to recapture them, what the research shows is that actually, the younger people, the younger children, the younger adolescents, the research indicates that they do have a higher level of health literacy than the adults, right? Compared to adult health literacy, the evidence on children and adolescents' health literacy could be rather limited. In other words, for simple reasons of approval, simple reasons of getting people to take them through the institutional review board. I'm not saying that that's the only reason, but generally it's easier to get adults to respond to surveys and gather the data than it is to get children or guardians of children to agree to this. So generally, we have less information. The research shows that the information on evidence, right, the data on children and adolescents' health literacy is comparatively limited compared to that of adults. However, from the data that we have so far, the Finnish data, for instance, from the health behavior, right, in school-age children shows that 1/3 of their 7th and 9th graders had high levels of health literacy, and around 60% had shown moderate levels. I repeat that. About 33% of the 7th and 9th graders, according to the data obtained from Finland, already had high levels of health literacy, and about 60% had shown moderate levels. So you have about 90% of the children in 7th and 9th grade in Finland already showing moderate to high levels of health literacy. Now, look at what that does look at how that relates compared to the adults. Generally, the findings from these countries in Europe show that when it comes to the adults, only about 50% had sufficient health literacy, because about 47%, that's about 50%, had limited health literacy. In other words, it's ratio 50 to 90%. On an average, you have about 50% of people in these European countries having adults, but specifically adults having sufficient health literacy, while about 90%, and that's why I said 90% of children had this moderate to high levels of health literacy. That's why I said the good news about education being a model, right, through which we can channel a prism, a framework, so to say, through which we can channel health literacy is positive for the future generation, especially, right? For those who are just growing, that is positive. I gave us the data on Finland. Let me give us the data on Lithuania, another country in Europe. The same HS health behavior in school-age children. The same results showed that there were high levels of health literacy in about 18% of the children, while 70% also had moderate levels. So about 87% of children in Lithuania had moderate to high levels of health literacy. About 90% of 7th and 9th graders in Finland had moderate to high levels, right, of health literacy. Meanwhile, when they took the data in the same Europe, you had only about 50% of adults. So only about 50% of adults having even moderate health literacy. The remaining 47% had limited, inadequate health literacy. So one of the things we are going to be looking at on this program over the next 3 months, over the next quarter, is how exactly can we adopt an innovative approach to ensuring that the adults who have already gone out of the regular school system, right, how do we ensure that we up the health literacy? And then for the children who have demonstrated the capacity to absorb health literacy now that they are still much younger, how do we ensure we are optimizing the education sector to pass on the health literacy that we need to, and to develop a culture of health literacy now that they are still young? We'll still attempt to build that culture of health literacy with the adults too, because it's very important and very significant. Well, this is still Tolu Omodara on Amogate Radio Communications. It's a joy, it's a delight to be starting a new series called Educating for Public Health Literacy, and we'll be back shortly. So now let's talk a little bit about, or a little more about why it is important for people to have literacy, right? Now, the research already indicates that health literacy is a key outcome of health education. That's not where we're going. And one of the impacts, right, of these is that there is usually improved population health, enhanced health promotion, and disease prevention across diverse contexts when there is higher health literacy. I repeat that. Health literacy is a key outcome of health education. In other words, health education is an input and the output will be health literacy. Now, when we have health literacy as an output, what it translates into in terms of outcome is that we now have improved population health, health promotion, and disease prevention across contexts, just because there is enhanced health literacy. We are going to unpack that in the weeks to come, but let's just put that in one corner of our mind. I'll repeat that. Health education translates into health literacy. So health literacy is an outcome of health education. Now, an outcomes of health literacy itself, as health education produces health literacy, so does health literacy produce improved population health, health promotion, and disease prevention across different contexts. So when we begin to see this health literacy responsible for improved population health, improved health promotion, and disease prevention across different contexts, we can begin to allude to the fact that one predictor of these outcomes is health literacy. When there's health literacy, there's likely to be improved population health, there's likely to be enhanced health promotion, and there's likely to be increased disease prevention, all as a result of better health literacy. And as a result, it becomes important to begin to think of how to invest in and ensure better health literacy. Another thing I want us to take note of, again, we've alluded to it, but let's look at it again, right? What exactly is health literacy, right? There are different definitions of health literacy. One of it includes how people find, understand, evaluate, use, and communicate health information. I repeat, one of the definitions of health literacy is how people find, understand, evaluate, use, and communicate health information. But another one that I seem to have loved, especially because of the final part, is something I'm going to refer to again. I spoke to it earlier, is the ability to obtain, comprehend, right? To obtain, process, comprehend, and act on health information to the end that people can make appropriate health decisions on their own before there is a medical intervention or the intervention of medical profession. This is extremely important because you simply need to ask yourself, what is the ratio of doctor to patients across the world? What is the ratio of doctor to patients across the world? So in Canada, for instance, we have about 277 patients to about 100,000 doctors. In other words, 2.77 patients to about 1,000 doctors. Right? So if you divide 100,000 by 277 patients, that's about 1 doctor to 361 patients. That's ratio 1 to 367. In the United States, you have about 100,000 doctors to about, about 295 patients in the United States. 100,000 doctors to 295 patients. If you divide that, that means you have an average of 1 doctor to 338 patients in the US. So that's an average of 350 patients to 1 doctor between the US and Canada. So the simple question is, how many doctors, even in these countries, how many patients, can the doctor see per time, right? Eventually, there is the need for medical attention. We've been talking about that a lot. There is the need for us to have enhanced, we've talked about that in previous programs, enhanced medical practitioners or improved numbers, quantity and quality, and so on and so forth. However, there is also the need to have more literate public, more health literate public, so that ultimately people, I'm going back to the definition again, people can obtain, process, comprehend, and act on health information in order to make effective health decisions on their own prior to the need for the intervention of a medical personnel. And this is where you can begin to talk about the preventive part of health. You cannot talk about the preventive part of health until there is a sufficient level of health literacy. Otherwise, everything will still be waiting to the last minute, and many times the medical practitioners themselves will tell you that is when it's often become too late. Preventive health is extremely important. We've talked about it in precursor programs to this program, and we cannot touch on the issue of preventive health until there is health literacy. Health literacy is a fundamental requirement for preventive health. So it is time for us to begin to say, how do we optimize whatever medical personnel we may have in the best of countries, in the most resourced of countries, with adequate, sufficient, effective, and qualitative health literacy. This is one of the reasons why this is very important for us, right? We need to go into the more preventive aspect of health, and we cannot go into the more preventive aspect of health until people have that ability to obtain the capacity to gather the health information, to process the health information, to comprehend the health information, to act on health information, and make the most effective health decisions on their own prior to the need. In fact, sometimes obviating the need, making unnecessary the need for medical intervention. This is one of the reasons why this program, this theme, is very important to us as a continuation of what we've been talking about. Public health literacy. How do we enhance public health literacy as a way of improving general public health? Well, we're wrapping it up here as for this first edition of the program. Before we do, let me just remind us about a couple of things. This is the third in this series, right? Welcome to a new quarter. This is the first session of this quarter. The first quarter, the first quadrimester, actually 4 months, was on public health and optimization of national possibilities. From there, we went to innovative possibilities for public health from January to March 2023. And now from April to June 2023, we will be talking about educating for public health literacy. It's extremely important for us to talk about it. It is one of the things we have to look at, and especially in the area of educating adults, right? When it comes to educating children from public health literacy, don't misunderstand me. It's important. We need to keep educating children. We need to keep educating adolescents. But generally, the data is indicating that because humanity is using existing structures, especially when it comes to education, it may be easier to infuse health literacy into existing educational structures. But for adults that have already gone through many school systems, how do we think of innovative ways of enhancing health literacy, globally speaking, among the adults? These are some of the things we'll be going deeper into. How can we deploy innovation, right, for enhanced and mass public health literacy, right? How do we deploy innovative possibilities for public health, especially with regards to adult health literacy, right? We'll also be looking at the advantages in more details of public health literacy across different geographical contexts, right? And then, of course, we'll be having different experts speak to us. We are only laying the foundation today, and we hope you've enjoyed the foundation. My name is Tolu Omodara, and we'll be back shortly. Well, as we wrap up on this edition of the program, let me state that in the next episode, where we'll still be laying the foundation, we will be looking at known channels for enhancing public health literacy. Before we talk about innovation, we are going to go to known channels for enhancing public health literacy. What are the channels? Like we said, education is one that has been explored already. So we're going to look at education for health literacy in some different national policies. How have some nations, used, for instance, early health literacy interventions in the educational sector, and what have been the benefits of this? I'll repeat that. How have some nations used early health literacy interventions, working with the children, working with the adolescents? How have they used early health literacy interventions in the educational sector, and what have been the benefits of it? So we will be looking at known channels of enhancing public health literacy. So we'll look at what has been done, what has been known, what has been exploited, before we now go to innovative channels for approaching mass public health literacy. I'll repeat that. When we have explored known channels for enhancing public health literacy, education being one, and what are the benefits of those early intervention, we'll then begin to explore innovative channels for approaching mass public health literacy, particularly with the older generation of the adults. This is where I draw a curtain on today's edition of the program, the first edition, the maiden edition of Educating for Public Health Literacy with Tolu Omodara here on Amogate Radio Publications. Please note that we want to hear from you. We look forward to hearing from you. You can follow us on LinkedIn, Amogate. Follow us on Facebook, Amogate. You can follow us on Instagram, Amogate. You can send us a WhatsApp chat on +234 810 9996666. We look forward to hearing from you. We really want to hear back from you, because we do this for you. We don't do this for us. And we thank you for always being here with us. Please take care of yourself. Remember, public health is everyone's responsibility. Stay safe, keep healthy, and continue to contribute to public health. Thank you very much, and take care of yourselves. Be good. Bye.